Well, here in Canada, we're dealing with the COVID-19 pandemic. We're listening carefully to public health officials, to government representatives to know how we can flatten the curve. We're taking prevention measures, and of course, we rely on our healthcare system. In so many parts of the world, those kinds of preventative measures and health systems are just not even in place. So today I thought we could talk a little bit about the impact of COVID-19 on vulnerable people in some of the world's most fragile places. So I'm really glad that I'm joined by Lindsay Gladding. Lindsay is a member of the World Vision Canada team. She's the Director of Humanitarian Emergency Response and Fragile Contexts. She has more than 10 years of experience in some of the toughest parts of the world. What's your take on COVID-19?
Yeah, thanks, Michael. I mean, I think what we are seeing is that this is a health crisis on a global scale and something that we have never been confronted with in the past. You know, we have lots of experience dealing with outbreaks in places like West Africa that dealt with Ebola, but never at a scale and scope that we're dealing with right now. And so really trying to use the lessons that we've learned in other disease outbreaks, but really, we're learning every day as we scale.
You think about the fact that we're trying to socially distance here, staying a hockey stick apart. I'm not sure there's anywhere in Cox's Bazar or parts of the Central African Republic where you can get a hockey stick distance apart. What does that mean for the kinds of things that we can possibly be doing in those contexts?
Yeah, I mean, when we look at Cox's Bazar in particular, we know that, you know, on the Diamond Princess cruise ship, people were, 24 people for 1,000 square meters. In Cox's Bazar, it's 40 people per 1,000 square meters. And we know that the disease spread 4 times faster on that cruise ship than it did in Wuhan, China at the peak of that outbreak. And so the potential for a COVID-19 outbreak in Cox's Bazar to really spread through that camp very quickly is of significant concern.
I know one of the ways that we try to mitigate the impact is by dealing with issues of protection for children, but also recognizing that the good news, I guess, is that it seems to have, at least at the moment, at least in the developing world, less of an effect on children than older people. But I know that some of the recent work and recent studies that we've done show that actually it's the secondary impacts of this, the pressures it puts on health systems that may prevent kids from getting vaccinated or getting access to primary health care, right? That has a ripple effect that we may not even begin to see here in Canada.
Yeah, and that definitely is concerning for us, right? So we did do some modeling, as you said, based on what we saw after the Ebola outbreak in West Africa in 2014 to 2016. And, there's the potential that, 26 million children could be, lives could be at risk because, as you said, they don't get immunized, or their family is worried about bringing them to a health clinic because they might catch COVID-19, but then succumb to some other illness at home because they didn't seek medical attention. And so they may not suffer the severe impacts from the disease itself, but definitely are dealing with the secondary impacts.
Well, what does give you hope in the midst of all of this, Lindsay?
I mean, I think it really is that because this has touched everyone across the globe, it really is garnering this sense of solidarity around the world, and a real recognition that, in order for us to be protected, we need to protect people around the world. And so I think that this really presents, us with a potential for a turning point in our response to global poverty, to issues of violence and conflict around the world, where we do really recognize that in order to be safe and secure here in Canada, we need to make sure that children are safe and secure, even in places like Central African Republic and the DRC.
Our World Vision teams are working in some pretty challenging contexts, and we talk about them being hidden heroes. Can you think of somebody that comes to mind for you who's a hidden hero for you in the midst of this?
I met a woman in Indonesia when I traveled there after the earthquake that happened, I can't even remember when now, a few years ago. And I met one of our staff who, in the aftermath of that earthquake, was separated from her family, didn't know where her children were afraid that they might be caught somewhere under the rubble of their town, and was immediately, responding, supporting others in her community, was going door to door to check on other families, all while, on the phone trying to contact her children, and just this real sense of community and desire to help others, even when her own family was affected and she didn't know whether or not they were safe or not. And I think it really is, this desire to reach out and to help others that is really inspiring.
Yeah. Lindsay, thanks for being with us, and thanks for helping us understand a little bit more about the impact that COVID-19 is having and could have on vulnerable populations in fragile places.
Thank you.